My name is Brittany. I'm one of the student nurse practitioners today. I'm going to do what's called a head, ears, nose, and throat exam. So I'm going to go ahead and look at your head, your eyes, your nose, your throat, and your neck, and do an exam. Okay. Provided privacy. Wash my hands. Can you state your name and date of birth?
Tina Jones, date of birth 8/13/1980.
Okay. Put on my gloves. So I'm looking at her face. It is symmetrical. Eyebrows and eyelashes are evenly distributed. I'm not seeing any redness or lesions on her face. There's no facial hair. I see that her nose is symmetrical as well. Same thing with her lips. I'm going to go ahead and look at your scalp. Go ahead and look down. So I'm looking at the texture of her hair. It's fine. I'm just palpating. Is anything hurt? Anything tender? No push on it? Okay. I don't feel any bumps or disformities or masses. Looking at the scalp, no lesions. Okay, go ahead and look up for me. Okay, and then we're going to look at the eyes. And so, grab my light here. All right. Okay, pupils round and reactive to light. So I'm going to go ahead and look at your conjunctiva. Look down side to side. Okay, sclera is white, no jaundice, and her conjunctiva or mucous membranes are pink and moist. The lactus apparatus, no tearing, no nothing like that I'm seeing. And then we'll move on to the nose. So then I'm just going to look in her nose. Okay. There's noted mucous membranes pink and moist, no septum deviation, no polyps. Same thing on this side. I'm going to assess patency. Go ahead and hold one side of your nose and blow, and then do it to the other.
Not tickled.
Sorry. Okay, nose is patent. I don't see anything. Lips are pink and moist as well. So I'm going to go back to your eyes. So we're going to do a visual field, okay? So go ahead and follow, your eyes follow this, don't move your head, okay? Okay, now I want you to follow, okay, with just your eyes. Okay, look at the pen, look over my shoulder and look back. Okay, extraocular movements are all intact, so we're going to do your peripheral vision now, okay? Okay, tell me when you can see.
Now.
Okay.
Okay. Now.
Okay, so peripheral vision is intact. Then we're going to move on to the mouth. So go ahead and open your mouth. Okay, so she's not missing any teeth, no caries. Nothing that I can see. Gums are pink and moist, so are cheeks, hard palate. Okay, go ahead and lift your tongue up. Okay, put your tongue down. Tongue is midline, pink and moist. Say, ah, I'm looking back of your throat. Okay, uvula is midline. Tonsils are not inflamed. The back of your throat is red or a pinky red. I don't see any exudate. This right here. Okay, and then we're going to palpate your sinuses. This is your frontal. Tell me if you feel any pain or tenderness.
No.
Maximal. No tenderness. Okay, and then we'll go ahead and look in your sinuses for translucent. Okay. Open. Okay. Open. Okay, and I do see it. Good. So we're going to go to your ears. Okay, inspect the outside of the ear. I don't see any signs of infection or inflammation. Same thing on the other side. Don't see anything. So I'm going to tug and pull on your ear. Tell me if you feel any pain or tenderness. Okay.
No.
No? Okay. So I'm going to go ahead and look in your ear. Okay, earwax noted. Ear canal is pink, moist, conolite noted. I see a pearly gray, pearly gray tympanic membrane. Some earwax noted, ear canal, pink and just pink. And tympanic membrane is pearly gray. Okay, we're going to swap this out now that we're done with this part. Swap this out. Left eye, left eye. All righty. All right, I see a red reflex going in. Okay, I see the arteries, veins, and optic disc. Look at me. Sorry. Okay, I see the red reflex and arteries, veins, optic disc. Okay. Of course, for that exam, we would turn the light out. And then we're going to go ahead and do your hearing. All right, ready? I want you to tell me if you can hear it on both sides or one or the other. Okay. This is the Weber.
Both.
Okay, this is the Ron test. Tell me when you can no longer hear it.
Now. Now.
Okay. Tell me when you do that when you can no longer hear it again.
Now. Now.
Okay. Go ahead and check your TMJ. Go ahead and open your mouth twice and side to side. Okay, no popping or clicking. So then I'm looking at her throat. It's midline. The trachea is also midline. No deviation noted. The color looks good. The temperature is good as well. I'm going to go ahead and feel your thyroid. Okay, no nodules. Go ahead and swallow for me. Okay, and then I'm going to go ahead and ask you to do the range of motion of your neck. So I want you to go to the left side, so left lateral, then right lateral. Okay, and then flexion, which is down, extension is up, and then dorsiflexion, same thing on the other side. Okay, and then do a rotation. Okay, any pain or tenderness?
No.
Okay, so make sure I did everything. I'll make sure I did everything. So I'm gonna feel your lymph nodes. Okay, this is submental, tonsillar. Tell me if there's any pain and tenderness. Okay, pre-auricle, post-auricle, occipital, posterior neck chain, anterior chain, cervical chain. Sorry, anterior cervical chain, posterior cervical chain, and anterior cervical chain. Go ahead and hunch over for me. Supraclavicular. Okay, I do not feel anything. There's no pain or tenderness. Okay, do you have any questions or concerns?
I do not.
All right, that's it.
Thank you.